Okay guys, so I want to start this video by giving you an experiment. On the count of 3, I want you to smile. 1, 2, 3. Okay, you can stop. Now some of you may be smiling from ear to ear and some of you may be hesitant. The truth is, no matter what we do, we can't deny that a smile has a massive impact on our well-being. Science says it too. It says we release endorphins when we smile. It's contagious. It's definitely a really strong part of non-verbal communication. But what makes the smile look beautiful? Well, that's something that not everyone tells you. So in this never seen before video, I am going to give you the 6 top things that you need to consider or think about when having a smile makeover, or if you want to have something done to your smile. But before I go on, please don't forget to subscribe and like to my channel so you can get more information. Now, tip number 1, lip assessment. Okay, why? Lips frame your teeth, so the way that they look and the way they sit on the teeth will impact your smile. We love smiles like Julia Roberts, Margot Robbie, Ryan Gosling. Their lip shapes are all different, and the way that their lips sit on their teeth impacts the smile. Lip filler can also have a massive impact on your smile. So for example, overfilled lips could end up covering lots of your teeth, making them look small. Also, the gravitational effect of the lip filler can also cause your smile to be less wide because you can't pull your lip up as much. Sometimes you have asymmetries in your lips because a tooth underneath, for example, is crowded, and what the injector will do is they'll try and balance that asymmetry by injecting at the other side. So I would always say, get your teeth done first, then the lips, not the other way around. What else do we have? Well, apart from lips, we also have gums. It's a thing, guys, having gorgeous gums, especially if you have a high lip line, because gum aesthetics are really important because we actually see your gums. Now, gums can be changed in different ways. So for example, if your teeth look really short, we can make them look longer by removing some gum. We have gum laser and crown lengthening. Gum laser is kind of for the more easy cases, but I always say it's a bit like cutting your cuticles. There is a risk of it growing back. We have something else called crown lengthening. That is actually done with my specialist. What he'll do is a surgical procedure where he lifts the gum, cuts the bone, stitches everything back, and you'll heal within a few days. But if you want something else later on, like veneers, there is some healing time of a few months, but it's all dependent on the case. Let's not forget, guys, that pink, healthy gums are important. So seeing the hygienist every 6 months to have a deep gum clean is super important. And you can maintain stuff at home by using an electric toothbrush twice a day, a water floss, I love water pick at the moment, and also TP brushes which go between your teeth. So we've got the lips and we've got the gums. What else matters? Okay, whitening. And we've all guessed it, because I get cases every day saying, I want to have teeth whitening, all I need is teeth whitening. Teeth whitening is not all that you need. You do need something else. But let's go on to whitening. Whitening is a peroxide-based system. Well, I lie. Only if you go to the dentist, because we know there's so many over-the-counter products. The thing is, though, is that you need a certain level of peroxide to penetrate the tooth and make the tooth go from yellow to white. The highest percentage of peroxide is 6% hydrogen peroxide or 16% carbamide peroxide. You can only get this from a dentist. So over-the-counter stuff won't have this. Also, you don't know why your teeth are the colour that they are. They may be the colour that they are because you've knocked them and had some trauma to the front tooth and they've got a bit purple or even yellow. So really you need to see a dentist to assess why they are the colour they are. But provided that your mouth is healthy, some over-the-counter products may be okay, but some of them may actually cause damage. So they may have abrasive particles that permanently strip away the enamel. And if it permanently strips away the enamel, you have the underlying dentine show through. The dentine is the more yellow part of the tooth, it's the more sensitive part of the tooth, so you could have issues with sensitivity and more yellow looking teeth. When you go to the dentist, what we do is we do an assessment, we take scans of your teeth, we have some trays made, we give you the trays to wear at night every night for 2 weeks or for a couple of hours each day. We'll give you either hydrogen peroxide or the carbamide peroxide and illustrate it. Have you had your teeth whitened and you're sitting here thinking, Dr. Rhona's lying, I had whitening and it didn't work. Guys, there is a limit to how white you can get. So for example, it's like me and someone else going to the hairdresser having the exact same peroxide placed on our hair and expecting to go the same color of blonde. The truth is that peroxide will react differently on people's teeth differently. So if you have a very yellow base, because of erosion, you might not respond that well. If you're a tooth grinder, again, you may have ground down the enamel. So then what would happen is that the more yellow part shows through, you're more sensitive, you're going to be less compliant. So different people respond differently. And also guys, if you're comparing yourself to people on the red carpet, they usually have had something done like composite or porcelain veneers. So please don't use that as something that should be taken. Now, we go on to my fourth point, and that is the position of the teeth. Now, the position of your teeth is super important. What do I mean by position? I.e. if they're sticking out, if they're sticking in, if you have a deep overbite, what we call a big overjet where the top teeth are sticking out a lot. The position of your teeth really is important, because not only can it affect the lips and the gums and so forth, the other stuff that we talked about, but also if you want other treatment like veneers, we won't have a lot of destructive preparations to the tooth. Now, with the position, we can correct it with braces. So you've got traditional braces like fixed that go on the front surface of the teeth, ones that go on the backs of the teeth, or clear aligners. And I love doing Invisalign, it's my favorite. It's a series of plastic trays. Each time you change the trays, the teeth move a little bit. There is a little bit of pain and pressure, but it can help reduce the position of your teeth. Now, if the position is right and the color is right, will you still be happy? Not necessarily. And that brings me on to my fifth point. The actual shapes of the teeth. The shapes of the teeth is important. So for example, if you have straight teeth but they have jagged edges or they're triangular in shape, you still might not be happy. And the way that you can correct that is by having bonding. Bonding is a white resin, and you either put it on the edges of the teeth or on the whole surface of the tooth. If it's on the whole surface of the tooth, it's a composite veneer. If it's on the edges, it's called edge bonding. Teeth can be whitened, bonding can't. So if you have the edge bonding, you want to have it placed just on the edges when you're happy with the color of the teeth. Composite veneers can mask discoloration because it can be done in layers. Porcelain veneers can also mask discoloration, but it requires some removal of the tooth structure, 0.3 to 0.5 millimeters or more if you need to mark a lot of discoloration, and if you didn't have the position corrected with braces, the preparation may be more destructive, which is why we always encourage orthodontics in sorting out your bite and the straightness first. Now, let's go on to the sixth point. How many teeth do you show on smiling? I referred back to those people that we love, Angelina, Julia. If you smile and you show 8, 10 or 12 teeth, this is something that we call having wide buccal corridors. And I actually did this on my Instagram and everyone was like obsessed, and they used to call up and be like, I want to get the buccals done, buccal corridors. It basically means that on smiling you have a wide smile. If you ever looked at celebrities and you can really tell that they've only had their front teeth done, it's because the back look a little bit narrow in the smile, a little bit small. We can correct the wideness by having braces, as I said, or having veneers or bonding to pull them out even more. But don't get too obsessive. When you smile, you just don't want to see two black tunnels on smiling. So let's have a little summary, guys. We want to assess the lips, assess the gums. We want to check the color of the teeth, the position of the teeth, the shape of the teeth, and also how many teeth are showing on smiling. So I hope that's been helpful, and we can correct all those things, but please do not forget to subscribe and like to my channel so you can get more information and we can go into these things in detail later on.